You're going to learn how a patient reversed her metabolic syndrome in 6 weeks as she lowered her high glucose, A1C, cholesterol, and triglycerides to normal, had more energy, and dropped 14 pounds of excess weight by healing her gut. And if you find this information helpful, please like and subscribe so more people can see this video. My name is Dr. Thomas Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of the FreeDiet. And most of the patients I see have gut, thyroid, or ferritin issues, and metabolic syndrome is a common thing I see, which is also known as insulin resistance. And you are considered to have it when you have at least 3 of the following 5: high glucose, triglycerides, low HDL, excess belly fat, and high blood pressure over 130/85. There's actually a simple test you can do to determine if you have insulin resistance, which I'll go over shortly. And I recently saw a patient who came in having been diagnosed with high blood pressure and prediabetes. She was complaining of indigestion, bloating, heartburn, pain, fatigue, brain fog, excess belly fat, and many other symptoms, including severe sugar cravings. She's had gut symptoms since she was a child, and she was prescribed 2 different acid blocking drugs, also taking 4 medications for high blood pressure, allergy medication, and another drug to help with her focus and concentration. And after all that, she was still feeling terrible. Initial lab testing indicated she had high A1C, glucose, cholesterol, triglycerides, insulin, below optimal levels of testosterone, her adrenal hormones, deficiencies of vitamin D, B12, and other nutrients. She had gluten sensitivity, leaky gut, and other food reactions, bacterial and yeast overgrowth in her gut, as well as arsenic and other toxins. So how gut dysfunction can be a root cause for metabolic syndrome is bacterial overgrowth and gluten sensitivity can cause leaky gut, which can cause chronic inflammation, which blocks insulin receptors. The liver can get overwhelmed and store excess fat. Blood pressure rises, insulin spikes, thus causing metabolic syndrome. So I put her on an anti-inflammatory diet and the proper supplements, which I'll go over shortly. And the end result was, after 6 weeks, her gut symptoms were better. She had more energy. Her sugar cravings were gone. She dropped 14 pounds, reaching her goal weight. And the following blood markers reduced to normal: her A1C, glucose, cholesterol, triglycerides, and the following increased to optimal levels: vitamin D, DHEA, and testosterone. And the one test I was telling you about that can determine your level of insulin resistance is called a HOMA-IR. So that's a calculation of glucose times insulin over 405. It's very simple to do. So in this case, she started at insulin 15 times glucose 116. That equals 1740 over 405 is 4.3, which is severe insulin resistance. And after 6 weeks, insulin 6.9 times glucose 84 over 405 equals 1.4, which is close to optimal insulin sensitivity. So less than 1.5 is optimal, ideally less than 1. 1.5 to 2.4 is moderate insulin resistance, and 2.5 and above, severe insulin resistance. So that's a simple test to check your status. So how she got better is with a diet I call the FreeDiet. It's a diet I came up with years ago when I was figuring out how to heal my own autoimmune Hashimoto's, thyroid, and rheumatoid condition, IBS, skin, and other chronic health issues. It's a diet that's free of not only gluten, but gluten grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, gut, thyroid, and other chronic health issues. I'll put a link below and at the end of this video so you can have the FreeDiet Phase 1 food chart we'd be happy to send you. And in summary, the diet consists of, for breakfast, a smoothie for breakfast that's high in protein, essential fats, fruits and vegetables, and fiber. Lunch and dinner, meat, chicken, fish, plenty of vegetables, and healthy fats. And as you improve in subsequent phases of the diet, you add additional foods back in to see how you do. You'll notice what you're avoiding in the diet: gluten, grains, sugar, yeast, processed foods. That includes seed oils, which, as I'm sure you know, can wreak havoc on your metabolic health. And the supplements I gave her include the Functional 5, which is multi, fish oil, D with K, magnesium, probiotic, other gut supportive supplements, supplements for healthy inflammation and cardiovascular support, which include curcumin, berberine with alpha-lipoic acid, some adrenal support, and then B12, CE, CoQ10, and other nutrients she was deficient in. So with this, she was able to heal her gut, restore her energy, reverse her metabolic syndrome, drop 14 pounds to get to her ideal weight. So if you have chronic gut fatigue or other metabolic symptoms, it's important to get the proper testing first, because if you find the root causes and are provided the right solutions, I believe almost anyone can get better. Thanks for joining me today. I'll put a video that goes into the free diet in more detail here. Free diet phase 1 food chart below that we'd be happy to send you. Feel free to like and subscribe so more people can see this video, and I'll see you next time.